Hello, welcome to c-meditech Online Academy. Today, we can do a question discussion from recent DHA Pharmacist examination. So, the first question is, a 62-year-old male admitted to ICU with septic shock is being resuscitated with a customized electrolyte solution prepared by the pharmacist. The solution contains 448 mg of potassium chloride with a molecular weight of 74.5 and 468 mg of sodium chloride with molecular weight of 58.5 diluted in 500 ml of sterile water. The intensive is concerned about the osmotic load of the fluid, particularly due to patient risk of cerebral edema and electrolyte imbalance. Assuming complete dissociation of both salt, what is the most appropriate estimate of the osmolarity of solution in milliosmolar per liter? So the question is asking about find the value in milliosmolar per liter. So we know that how will you find out the milliosmolar per liter? Milliosmolar per liter can be easily found out by finding that is millimoles into number of particles. Either you can find by using this formula or you can substitute by in this formula completely. That is milliosmolar per liter is equal to milligram into 1000 divided by molecular weight into volume into number of particles. So in this case, we are multiplying by 1000 because here we are asking about find out the milliosmolar per liter. Okay, not about osmolarity. We have to convert it into milliosmolarity. That is why we are multiplying here with 1000. It is asking about osmolarity. There is no need to multiply here with 1000. So you have to calculate this value separately. That is for potassium chloride, when you substitute the values, here the values are given directly. That is 448 into 1000 divided by molecular weight of potassium chloride is 74.5 into volume is 500 into number of particles. That is potassium chloride dissociated to potassium and chloride. So you get the number of particles as 2. So when you multiply these two, you will get the value as 24 milliosmolar per liter. Similarly, you have to find the value for sodium chloride also. So here when you do the calculation, the value becomes 32 milliosmolar per liter. So combinedly, you have to find out the milliosmolar for both of these substances. That is the total osmolarity will be 24 plus 32, that is about 56 milliosmolar per liter. So the answer will be option C, 56 milliosmolar per liter. Next question number 2. A 68-year-old woman present to the emergency department with retrosternal chest pain occurring at rest for past 2 hours, radiating to her left arm. Her past medical history is significant for hypertension and a previous arachidonic hemorrhage 2 years ago. Her current medication include metoprolol 25 mg twice daily and hydrochlorothiazide 25 mg once daily. ECG shows ischemic changes suggestive of unstable angina. Considering her history and current presentation, what is the most appropriate next pharmacological step? Okay, so in this case, a 68-year-old woman and she is having in the previous history, she is having a subarachnoid hemorrhage 2 years ago and now she is having unstable angina. So what is the most appropriate pharmacological step? That's the question. Okay, and currently she is taking metoprolol 25 mg twice daily and hydrochlorothiazide 25 mg once daily. So in this case, while evaluating the question, the patient with unstable angina and a previous history of subarachnoid hemorrhage, we can safely give clopidogrel instead of aspirin. The reason is that if we give aspirin to this patient, there is a chance of recurrent intracranial bleeding. Okay, so to prevent this recurrent intracranial bleeding and to prevent this condition, we can safely give clopidogrel instead of aspirin because clopidogrel comparing to aspirin is having lower chance of causing bleeding risk. So the answer is start clopidogrel. Question number 3. A tertiary care hospital is comparing two antihypertensive drugs for inclusion in its essential medicine list. A drug X reduces systolic blood pressure by 15 mg Hg and costs 500 per month, and drug Y reduces systolic blood pressure by 15 mg Hg and costs 1,500 per month. Both drugs shows identical clinical efficacy and safety profiles in large randomized trials. Due to budget constraints, the hospital want to select the most economically appropriate option. Which type of pharmacoeconomic analysis is most suitable in this scenario? A. Cost-effective analysis. B. Cost-utility analysis. C. Cost-benefit analysis. D. Cost minimization analysis. So in this case, by evaluating the question, both this drug X as well as this drug Y, both of them shows identical clinical efficacy and safety profile. Only the cost will be different. Okay, so if both the drug is having identical clinical efficacy and safety profile, we will mainly do that is cost minimization analysis will be conducted. Okay, so if the outcomes are different, if the outcomes are same, we can do cost minimization analysis. because the outcomes are identical here. Both of them have identical clinical efficacy and safety profile. So that means outcomes are same here. So we can do cost minimization analysis. The outcomes are entirely different when we will conduct cost effectiveness analysis. Okay. Then in case of cost utility analysis, if the question is about finding the quality adjusted life years and all, we can use this cost utility analysis and cost benefit analysis. Cost benefit analysis means you usually express outcomes in terms of monetary value. In that case, we can use cost benefit analysis. So in this case, since the outcomes of both the case outcomes are identical, we can use cost minimization analysis to find which is more cost effective. So the answer is that is cost minimization analysis, that is option B. Question number 4. A 52-year-old chronic alcoholic is brought to confusion, unsteady gait and abnormal eye movements. On examination, he is disoriented with horizontal nystagmus and ataxia. MRI suggests involvement of mammillary bodies. Which of the following deficiency is most likely responsible? So in this question, it is given that the patient is a chronic alcoholic and the symptoms given is confusion, unsteady gait and abnormal eye movements. So these symptoms in chronic alcoholics represent Wernicke's encephalopathy, and this condition is mainly due to the deficiency of thiamine. Okay, so deficiency of thiamine mainly occurs in chronic alcoholic patient, and that is to this thiamine deficiency nerve damage occurs, and the condition is called as Wernicke encephalopathy. So here the most important deficiency occur in this chronic alcoholic patient is option B, that is thiamine. Next, question number 5. A 34-year-old woman present with weight loss, heat intolerance, palpitation and tremors. On examination, she has tachycardia and fine tremors. Laboratory findings reveal markedly suppressed THS levels. Which of the following is most likely diagnosis? A. Hypothyroidism, B. Hyperthyroidism, C. Subclinical hypothyroidism, D. Euthyroid 6 syndrome. So, while evaluating the question, it is given that a 34-year-old woman present with weight loss, heat intolerance, palpitation and tremors, and these conditions indicate the patient is having hyperthyroidism. So the answer is option B, that is hyperthyroidism, because that is the weight loss, heat intolerance, tremors, tachycardia with suppressed TSH levels, and these are classic symptoms of hyperthyroidism. And question number 6. A pharmaceutical company observes poor tablet uniformity due to inconsistent powder flow during compression. To overcome these issues, the formulation scientists convert the powder into granules using wet granulation technique. What is the primary advantage achieved by this process? A. Reduced bioavailability, B. Improved flow property, C. Decreased dissolution, D. Increased toxicity. So here we have to improve that is tablet. That means we have to here the that is scientists observe poor tablet uniformity, and you have to convert that into that is you have to improve the uniformity. That is why you have to convert that into granules. So what will be the answer here? That is to improve the uniformity. That means improve uniformity. Along with that, when it is converted to wet granule, that means they will increase the flow property. Along with it, it will also improve the compressibility properties. So the answer will be option B, that is improved flow property. Question number 7. A 60-year-old man present with femur, productive cuff and pleuristic chest pain. Gram staining of sputum revealed gram-positive lancet-shaped diplococci appearing violet in color. Which organism is most likely responsible? A. Staphylococcus aureus, B. Streptococcus pneumoniae, C. Klebsiella pneumoniae, D. Pseudomonas aeruginosa. So here, this question, a 60-year-old man present with fever, productive cough and pleuristic chest pain. Gram staining of the sputum reveals it is a gram-positive lancet-shaped diplococci appearing violet in color. So which is the gram-positive organism in this option? That is Staphylococcus, Streptococcus, Klebsiella pneumoniae, Pseudomonas aeruginosa. So the answer is option B, that is Streptococcus pneumoniae. It is usually gram-positive in nature and appear as a lancet-shaped diplococci. So you know that gram-positive when gram staining usually appears in violet color. So the answer is Streptococcus pneumoniae. This Klebsiella all are gram-negative organisms. The answer is option B, that is Streptococcus pneumoniae. Question number 8. A 45-year-old man with newly diagnosed depression is prescribed standard dose of a tricyclic antidepressant. Within a few days, he developed severe anticholinergic side effect, confusion, and arrhythmia, even at low doses. Genetic testing revealed that he has reduced metabolic activity of a hepatic enzyme responsible for drug clearance. Which of the following enzyme is most likely involved in this patient condition? CYP2C9, CYP2D6, CYP3A4, and TPMT. Okay, so this is question from Pharmacogenomics section. In this case, it is given that the 45-year-old man is diagnosed with depression and is given a tricyclic antidepressant. So normally, tricyclic antidepressants are metabolized by enzyme known as CYP2D6. So here, that is, there's a deficiency of this hepatic enzyme, that is CYP2D6 is responsible for these symptoms like anticholinergic side effects like confusion, arrhythmia occurs. So if poor metabolizers, the enzyme level will be extremely low. Which enzyme? CYP2D6. So the enzyme level will be very low. At that time, what happened? The metabolism of this tricyclic antidepressant does not take place. So when the metabolism does not take place, what happened? The anticholinergic side effect predominate. So here the answer will be CYP2D6. So deficiency of this enzyme is responsible for the severe anticholinergic side effects. So the answer is option B, CYP2D6. Question number 9. A young adult present after internal injection of multiple tablets. X-ray abdomen shows a radio-opaque tablet. Toxicologists recommend all bowel irrigation to rapidly clear unabsorbed drug from GI tract. Which substance is most likely ingested? Organophosphate, iron tablet, cyanide, methanol. So which, that is, here it is given that a young adult present after internal injection of multiple tablets, X-ray abdomen shows radio-opaque tablets. So X-ray abdomen shows radio-opaque tablets along with whole bowel irrigation. So this clearly suggests that it is iron toxicity. The patient is having iron toxicity. So we know that in case of iron toxicity, the specific antidote for iron toxicity is desferoxamine. So here the radio-opaque tablet on X-ray examination with an indication of whole bowel irrigation. These are characteristic features of iron toxicity or iron overdose. The answer will be option B, iron tablet. Question number 10. A patient present with influenza-like illness and is started on oseltamivir within 24 hours of symptom onset. The drug worked by inhibiting which of the following? A, viral DNA polymerase, B, neuraminidase, C, reverse transcriptase and protease. So here the patient is having influenza, that is why the doctor has prescribed oseltamivir. And we know that oseltamivir is a viral neuraminidase inhibitor. So the main function of oseltamivir is it prevent the release of new viral particle, thereby protect the healthy cell from this infected virions. Okay, so here the answer will be neuraminidase inhibitor. That is option B is the answer. Question number 11. A 19-year-old male present with liver dysfunction, tremors and psychiatric symptoms. Slit lamp examination revealed Kaiser-Fisher rings. Which drug is most appropriate initial therapy? Desferoxamine, penicillamine, dimercaprol, EDTA. So here the patient is having liver dysfunction, tremors and psychiatric symptoms and is also having Kaiser-Fisher rings. So Kaiser-Fisher rings means it is due to copper accumulation around cornea. Okay, that is why this type of rings appear. So copper accumulation, we know that it is a copper accumulation, mainly which type of drug? Penicillamine. Okay, so this copper accumulation, that is a genetic disorder in which the copper will not be metabolized in our body. That condition is called as Wilson disease, and in Wilson disease, this Kaiser-Fisher ring appears. That means mainly the copper accumulates around the cornea. That is why this type of rings appears. And in this case of copper accumulation, the major drug or antidote is penicillamine. So here the answer will be option B, that is penicillamine. Question number 12. A patient with chronic stable angina is already on beta blocker therapy but continues to have exertional chest pain. So the following is the most appropriate add-on drug. So here the patient is having stable angina and he is taking beta blocker, but he is again feeling exertional chest pain. So exertional chest pain is again feeling, even though he is taking beta blocker, is due to this increased myocardial oxygen demand. So which is the best add-on drug? That is the question. So here we can give the best add-on drug is calcium channel blockers. So when calcium channel blockers given along with this beta blockers, we can prevent this myocardial oxygen demand. Thereby we can prevent this exertional chest pain. So the answer will be option B, that is calcium channel block. Question number 13. A patient is accidentally infused with hyperosmolar solution. Shortly after cellular dehydration is observed. What is most likely cellular effect? A, cell swelling, B, cell shrinkage, C, no change, D, hemolysis. So when a cell is placed in hyperosmolar solution, what happens? Usually this hyperosmolar solution, the concentration is very high. So it usually draws out from the cell. Okay, so what happened? Cellular shrinkage occurs. Okay, so when a cell is placed in a hyperosmolar solution, it will draws out the water out of the cell. That may lead to cell shrinkage. So the answer, the option B is the answer, that is cell shrinkage. Question number 14. An alcoholic patient presents severe pneumonia and produce thick blood tinged sputum. Culture shows a gram-negative bacillus with a prominent capsule. The most likely organism is Streptococcus pneumoniae, Klebsiella pneumoniae, Staphylococcus aureus, and Enterococcus. So here it is given that the patient is severely alcoholic and is having blood-tinged sputum. Along with that, the culture shows the presence of gram-negative bacillus. So gram-negative bacillus with a prominent capsule is Klebsiella pneumoniae species. They usually have a prominent capsule. Along with that, they cause this damage of this that is lung tissue. That is why the blood-tinged sputum appears. Okay. So the one with gram-negative bacillus with prominent capsule, the answer will be Klebsiella pneumoniae. So the answer is option B, Klebsiella pneumoniae. Question number 15. An elderly hypertensive patient with a history of intracranial hemorrhage requires additional blood pressure control. Which of the following is the safest option? Aspirin, warfarin, amlodipine, heparin. So here the patient is elderly and is having history of intracranial hemorrhage. So in case of intracranial hemorrhage or in case of already have patient is having bleeding, okay, previously having a history of bleeding, we can't give any other anticoagulants. So the safest drug to give in this patient is amlodipine. Other all cause increase the risk of intracranial hemorrhage. So the answer is option C, that is calcium channel blocker. Amlodipine can be safely given to this patient. Other will increases the chance of this intracranial hemorrhage. Okay. So the option C, amlodipine is the answer. So this is all about today's question discussion. Thank you. So for GCC exam related coaching and for data flow related queries, please do contact c-meditech online academy. Thank you all.